Good morning, Wakefield, and welcome to the last Friday in August. Hard to believe that we're here so quickly. Seems 4th of July just came, but in any event, thank you for joining us today. And as I said, I think last week, I'm sorry that we are back talking about this subject again. So in any event, a lot has happened statewide and community-wide, and most definitely an increase in cases. So with that, I will turn that over to our health agent, Elaine Silva, to tell us a little bit of what's happening on locally and in the area. Elaine, you just need to unmute yourself.
Yep, I got it. Thank you. Good morning, everyone. I do wish we were meeting in person over something very, very happy, like a big celebration, but we're not. We'd like to, first of all, thank Mr. Mayo and Amy Faziati and Cindy Longo and Mr. Tom Walsh for helping us and getting our tracers back up here in Wakefield, which has helped a lot and tremendously allowing us to see any trends. And to Superintendent Lyons and the school committee, thank you so much for your very, very informative meeting the other night. It was great to see that and to see how well you explained everything that's going on. We have seen an uptake in cases, definitely. Most of our cases, again, are either the young children or those in their 20s. Most people are vaccinated. They're breakthrough cases. We've had no hospitalizations and no deaths that we know of, which we are very, very fortunate with. It's not like that first time around. Those that are vaccinated are definitely getting what we call breakthrough cases. They're very, very light. Sometimes the person will get what they just think is a tiny little cold symptom, a little stuffy nose or a cough. And it's like 4 or 5 days later, they may lose their taste or smell. And all of a sudden they go, uh-oh, I think I have it. And then they go and they're tested and they're positive. We had 50 cases this week here in Wakefield. It was quite an uptake, but the uptake has come, if you listen to the news, yesterday was the largest number of positive cases in the state of Massachusetts. And we're not exempt from that. Our local communities, as you know, we're with Melrose, so we're running same numbers there. Our local public health nurses have been in contact with each other. They're running the same amount of cases. The tracers are starting from the state again. They've just trained 150. We're getting some up again in Melrose to give us an assistance. The one thing that we're seeing in the younger children is, unfortunately, they're bringing it home to their vaccinated parents. We do see also a little bit of an uptake in cases due to traveling. We have a lot of families coming back from last minute vacations, and with school starting in another week or so, this can kind of put a little bit for the children. If they're in isolation or quarantine, they may not be able to come back on that very first day. And Superintendent Lyons, we're asking you that maybe you could get that message out to your parents and remind them if they have a child who's positive or they do have a family member, that they do check with your COVID nurses and make sure that they have the correct date for that child to come back to school. We're just hoping that maybe this is another trend and maybe we'll see it go down. Flu season's around the corner. We've seen the new FDA approval. We're hoping, and we thank you, Mr. Walsh and Mr. Mayo, for arranging to have that vax van in. We're hoping that we'll pull our rates back up and we'll hopefully get this virus a little under control. But with flu season coming in, it's going to present a little bit of a problem here and there. But we're already planning for it and we're ready. We're ready to go tomorrow.
Great. Thank you, Elaine, for all your good work. Tom Walsh, our Emergency Management Director.
Hello, everyone. I know everybody's going to give numbers and everything, so I'm going to stay away from the numbers. I just want to say a couple of things. I know everyone is probably COVID weary at this point because we've been into this thing for about 1.5 years. So, and then we've got the vaccine out and a lot of people got vaccinated. And then as I speak to people, as people talk to me, they're telling me, I'm vaccinated. You know, why do I have to wear a mask? Why do I have to do things? And the easiest question is this, the answer rather, is that maybe you have friends or family that you want to now socialize with, and they have loved ones that you may infect because you didn't, take care of business. Maybe you were in a crowded area, or when you probably should have washed your hands because you feel now you're in a comfort zone. You're safe because you got the vaccine. And my thing is, does anybody really want to be responsible for infecting these other people that are close to you? I mean, everyone now wants, when you find out someone's, hey, my friend is now vaccinated, I can meet with them. Oh, that's great. But I didn't take care of business over here. I went into this crowded restaurant and, I stayed and I probably shouldn't have. And then I ended up catching it. And now I just gave it to a friend of mine's, young child or grandchild. Those are the questions you have to ask yourself every day until we get, this thing done. And I know this Delta variant came up out of the blue. I mean, we were doing everything on the COVID-19, trying to get everybody done. And this thing came up. But the unfortunate part is we didn't know enough about it initially. We now know it's probably 100 times more contagious than COVID-19. So we still have to be vigilant, the washing the hands, the social distance, mask when necessary. Those are the things you have to do that are important for everyday life. We're going to get by it, but everybody still has to do their part. That's all I have to say on that.
Thank you, Tom. Thank you very much. And excellent advice. You're absolutely correct. Doug, how are we doing?
Good. Thank you very much. Thank you again for hosting this call. It's been a busy week. So I think I'd like to start off just by saying, thank you to Tom for the support and getting our vaccination clinic up and running. And thank you to Elaine Silva for her work on the Board of Health for supporting us as well. Just I'll go by the numbers very quickly. Vaccinations, you've heard me say this before, our coverage in Wakefield for vaccinations for students is very strong. When we look at the 12 to 19-year-old age group in the aggregate, our percentages are high. However, if we break it out between age 12 to 15 and 16 to 19, I think you'll see that the 18 and 19-year-olds have a considerably higher number than the 12 to 15-year-olds. So it kind of skews the percentage. You've heard some people pass around this percentage that 77% of our high schoolers are vaccinated. That's not completely accurate, right? So we need to that 77% is a DPH number. We really need to drill down and disaggregate that information. If we kind of flip the script and look at, not our percentage, but if we look at the number of students in that age group that aren't vaccinated, just as a frame of reference, in students ages 12 to 15, we have almost 500 students, 494 students that have yet to be vaccinated. In our 16 to 19-year-old age group, we have only 261. So, which is why those percentages are the way they are. So what we're doing is we're trying to stand up a vaccination clinic, or clinics plural. We had one yesterday. The participation was steady. I think we probably got about 25 or 30 people vaccinated. And for us, we'll take whatever we can get. If that kind of reduces that number or increases our vaccination rates, it's a mitigation strategy that we think is kind of our most powerful, as Elaine and Tom have said. Other changes this week, the Commissioner of Education has mandated that masks be worn in school. And so that is a requirement of the state. We do have a new policy in Wakefield. The state mandate takes precedent over the school policy. All students returning for any programs, for athletics that are happening inside, spectators that are happening inside, students coming back for orientation next week will all need to be masked. And so if you have questions about that or we can help in any way, please don't hesitate to reach out to your school principal, and school nurses will be in next week training. So more to follow there. We also shared on Tuesday evening that we are rolling out or collaborating with the state to incorporate 2 testing models. One is a model that they call test and stay, which is, sometimes referred to as a close contact model. If you are not symptomatic, but you are a close contact, You can test in school for 5 consecutive days, and if you're negative each time, you can stay in school. Our nurses are training on that program, and we'll have more information out shortly on that. Symptomatic testing is something that we're also rolling out, that if a student is presenting with mild symptoms, that's symptoms not like a fever or something more significant or prominent that would, really be a priority for us to dismiss a child, we can provide a test in school, and if the student tests negative, they can get back to their class. The goal in all of these mitigation strategies, vaccination, masking, and testing, the goal in all of this is to get students back into school and to keep them in school. We want to really limit the amount of time that students are out of school. That's the goal of all of this. I also want to let everybody know that our athletic schedules are back in full schedules for the fall. We're going to be meeting with coaches today just to discuss mitigation strategies, and our band students are back in a full competition schedule as well. And I don't think athletic director Kent or our fine and performing arts director Tom Bankert, I don't think that they could be happier to be able to offer those extracurricular activities to students. So that's where we're at. If anyone has questions, please don't hesitate to reach out. And again, thanks for the opportunity to share.
Thank you. Thank you, Doug. We are pleased to have former chair of the town council, Ann Santos, here joining us today. And if she's a little sad, she just dropped off her baby at college, so but she's going to give us some words of wisdom.
Thank you all, and thank you so much for the Wakefield team who has been exemplary, every department. And I want to be especially specific to thank Superintendent Lyons, the Wakefield School Committee, and his team for a really thoughtful policy in moving forward to get our students face to face. I work at a university in Boston, and we just welcomed 500 new students last Monday. The joy was palpable. These are law students who have been remote for probably 18 months. For them to be in a school setting was just joyful. And for the upper class students returning, the same thing. We are doing at our place what we're doing in Wakefield. The mitigation works. So I didn't think I'd be teaching in a mask in June, teaching in a mask to a room full of mask students, but that's okay, because that's how we mitigate this, and that's how we stay safe. And if we vaccinate and we are masked, that's how we move forward, and we can stay in doing business that's a little more normal than certainly we've had. So I think it's going to take the cooperation and goodwill of our community, which I have so much faith in. If a store suggests masks optional, throw your mask on. Pre-Delta, I might not have put my mask on because I thought, I'm vaccinated, I'm okay. Well, that's not the science right now. So I would suggest that people, for hopefully not a long time, can be mindful of that, because we have kids in the community that cannot be vaccinated, and that's where my concern is. I'm not going to be selfish and think I'm vaccinated, I'm going to march around without a mask. So I really do think it's going to take our goodwill, and I have so much faith in our community that we can do that. So thank you all for, I didn't hope we didn't have to be on this call again, but I'd like to just send the best wishes from the town council as well. And again, very strong support for Superintendent Lyons for what he is doing to get our kids back in school safely. Thank you.
Thank you, Ann. And to dovetail on that, the town council is meeting Monday night in a one-issue meeting to discuss masking in the municipal buildings, which will be the recommendation from my office anyway, after meeting a lot with Tom Walsh and Elaine Silver. And I got to give Laura Gorville a lot of credit on the Board of Health, had a lot of contact with her, and I have bought her Swiss cheese analogy. Exactly. So Laurel, you were right on this issue all along. But to talk about the greater town, it's a great segue in about what can we do. We want to keep the economy open. We want to be able to enjoy these things. So We are going to do a little bit more messaging in this amount. So maybe if Jen can share her screen and a little more subtle messaging here, but what we're trying to do is keep Wakefield open. So Jen.
Sure. So I floated a couple of concepts around. I think people landed on this one. These are just drafts so far. Don't look too close because I haven't proofed them yet. But you know, just like Superintendent Lyons said, the goal is to keep kids in school. Our goal is to keep Wakefield open using some or many of the you know, safety protocols in place. So these are messages that you've heard before. You've probably read or heard the guidance, but hopefully with kind of a refreshed look, we won't feel, I know everybody has kind of a, they don't see things anymore. They don't hear things anymore when they're said over and over. So perhaps with a bit of a different angle to them, it might jog our memory for a minute. I also just wanted to say one thing. If you were unable to attend the vaccination clinic that was held at Wakefield High School, I do want to let you know that Melrose High School on Monday is going to have the Vax bus in their parking lot. Melrose High is just a quick right off of Main Street at 360 Linfells Parkway. They'll be there from 2 to 7 p.m. It's walk up, no appointments necessary. So if you haven't, you know, didn't want to make an appointment or wait in line at the pharmacy, you can head over on Monday afternoon into the early evening at Melrose High School.
Right. And I think, do we have another one next week at Wakefield High School as well? What's the date and time? I think it's on the September 1st.
It's
Thursday.
September 2nd at 1 to 5.
1 to 5. So that's Thursday, September 2nd, 1 to 5. Please take advantage of that because as Superintendent Lyons said, quick back of the envelope calculation is probably 1/3 of eligible students are not vaccinated right now, roughly, in a rough sense. So we really want to keep them protected. And if you're in that 20 to 29-year-old age group in Wakefield, roughly 1/3 of you aren't vaccinated. And I know, like when I was 20 to 29, you know, 30 years ago, I thought I was invincible too. But you know, like Tom was saying, it's your nieces, your nephews, your children, your grandparents, or your that are a little bit more vulnerable. So please, you know, really think hard, get the shot. We want to keep everything open, want to keep things moving. Overall, you know, Wakefield's pretty good with, you know, 73% of people having at least one shot. But again, in those couple of age groups there, particularly 20 to 29, it still seems to be lagging. So, and you're the group that's out the most. You know, you want to enjoy all what you're doing. So please consider it. Other than that, does anybody have anything else to add? Steve Ingles, anything?
I would maybe, when Doug was mentioning our policy, also mention what came up was that aside from what the state was mandating, we're also covering pre-K. That means the Doyle School. And in our meeting, Karen Morrow brought up a very good point, which is that we have a number of the population that are immunocompromised. And part of keeping everyone in school is going to be part of that mask policy. And to what Ann was saying, staying together as a community and sort of looking out for each other. So just so there's no confusion, the Wakefield policy does go a little bit beyond, and that's the reasoning behind that.
I think that's great. And I think we will see, you know, anecdotally, I see more and more people masking up, being careful, and we ask that you do that, particularly because of, you know, you go through your mind, how many people have you had contact with in the last week, and we all run through that, and there's a lot of people. We want to make sure that that doesn't get down the road. Does anybody have anything else to add here today? Nothing? All right, I think we hope to give everybody the long weekend off so we can recharge for the start of school. So next Friday will be most likely will be a non-event for us, for our group here, because Doug needs to make sure all the desks are set up correctly in the schools and everything's done. I'm happy to come over and help you, Doug. Whatever you need, and we'll also make sure that when we do, you know, roll out things, that we do talk about making sure that people do use their mask correctly. Doesn't mean that it's, you know, Let me model this. I think that's what they do in school, right, Doug? They have to model, right? This does not mean that your mask is on correctly, guys. It's got to cover up here. All right. So let's mask up. Let's be safe. Let's have a nice weekend and do the right thing. Okay. Thank you, guys. Have a great
Thank
day.
you, everybody.